Good afternoon to everybody. I wish to thank Chiesi Company for inviting me to this important meeting. Only a few slides before to introduce the first speaker. And nothing to disclose. I think it's very important to underline with you the sentences that we can find in the neonatal resuscitation guidelines, in which we underline the difference between the newborn and the newly born. In the delivery room, the subject is the newborn just after birth. It's very important, this moment that we spend in the delivery room with this baby, because we say this moment the first golden minutes of life, and according to the words that we can read on this paper, there is an increasing body of evidence that reveals that the intervention performed during resuscitation of very tiny babies may have a direct influence on the immediate survival and also for the long-term morbidity. So we know that not many babies need to be resuscitated. The majority of them need always to be facilitated to perform the fetal neonatal transition, to change these terms. So we know that the chronic lung disease is a multifactorial disease, but the prematurity is the most important factors. But also the ventilator-induced lung injuries play a critical role in the pathogenesis of the chronic lung disease. The ventilator-induced lung injury may start in the delivery room. So we know that only few manual ventilation with a large tidal volume may compromise the compliance of the baby and cannot be resolved by the surfactant replacement therapy. It's very important to perform a protective resuscitation strategy from the first breath. In this animal experience, it was demonstrated that using a low tidal volume and choosing appropriate maneuver or resuscitation, for example, a sustained lung inflation, and to use the surfactant, we can reduce not only the lung inflammation, but also the brain damage as demonstrated by the histological report. So I conclude that the first golden minutes are very important in order to allow the fetal neonatal transition to reach an alveolar recruitment, to reach an early FRC. It's very important to protect both the lung and the brain. It's very important for the hemodynamic stabilization and for initial metabolic control, example for the temperature, for the glycemia. So it's a pleasure for me to introduce the first speaker, Max Venter, Professor of Pediatrics. The first talk is about probably the neonatal management. Please, Max.